Hi, my name is Kaylee Gray. This is my presentation for week 2 of Biology 1030, Pathophysiology. These are my notes. Today we're going to be talking about diseases. Diseases are acute or chronic conditions that one acquires or is born with, and they cause physiological dysfunction in one or more body systems. Like I said, they're classified as being either congenital conditions, or something someone is born with, or acquired conditions, which is something that they get from outside. So a good example of congenital condition would be sickle cell anemia. That's something that someone is born with from genetic dysfunction, either from the mother or from the father, from both. An acquired condition would be something like COPD that's caused from exposure to outdoor pollutants. When we talk about the cause of disease, that's called the etiology. And etiology, again, is the cause of a disease. There's a number of different things that might cause disease. It could be a biological agent, like a bacteria or a virus. It could be a physical force from an injury, loss of function in some way, something like that. They could come from chemical agents. We've all heard the great TV commercials. Call this 1-800 number now if you've been exposed to asbestos, because you might have mesothelioma. They could come from genetics. Again, we talked about sickle cell disease. Another one that's really commonly known is Down syndrome, which is trisomy 21. We also talk about diseases that are stemmed from nutrition deficits. A good example of that would be something like kwashiorkor, which is a protein malnutrition that we see in like lower socioeconomic groups. When we talk about how the disease process evolves, that's the pathogenesis. That's how it evolves and the sequence of events from the initial exposure, the initial contact with the etiological agent, something like that, until the ultimate expression of the disease. So we might talk about something like tuberculosis. In tuberculosis, you're exposed to an outside bacteria, and it manifests and turns into the tuberculosis disease that we know of. When we are collecting information and data on someone's health and what might be affecting them, we talk about their symptoms. Those are subjective complaints that a patient might have. So they might come in and say that they have a headache, or that they're experiencing pain, that they're experiencing nausea. Those are things that are subjective to that patient themselves, and they're able to tell you how they feel, but you are not actually able to do any diagnostic criteria on that and on actually measuring it. Versus a sign of a disease, which is a manifestation that can be noted by an observer. So that might be something like taking their temperature and finding that they're running a fever, or noting that they have swelling or are jaundiced, something to that effect. When we compile all of those symptoms and signs together, we call that the syndrome. Those are all the characteristics of that specific disease state. And that gives you a whole picture of what's happening with the patient in that disease. We get all of that information together, the signs, the symptoms, to come up with a syndrome, and with that we come up with a diagnosis. A diagnosis is a designation as to the nature or cause of a health problem that's based on the syndrome, on a physical examination, and usually on diagnostic testing. We do a number of different diagnostic tests we perform a number of diagnostic tests to validate what we believe is happening with the disease. Diagnosis tests are weighted against standardized normal values so that we have a pretty clear indication of what's happening. A good example would be a diabetic patient. One of our markers for measuring diabetes is a hemoglobin A1C value. And so you might want to regularly check a patient's hemoglobin A1C to see how they're doing every 3 months or so, to make sure that the current treatment protocol is working, or maybe that it's not working and we need to adjust something because their A1C number is hugely outside of normal limits. We use all of this information together to come up with a prognosis, which is how we expect the probable outcome of the disease to process and the prospect of recovery from that disease. So say, for instance, you are diagnosed with cancer. You might go see an oncologist who performs a number of diagnostic testing, imaging, pathology testing, things like that. Then they come back and they say, this is the kind of cancer that you have, these are the causative factors, we would like to treat it with radiation and chemotherapy and whatever else, and this is the prognosis that we expect to have as we go through this healing process. And now with any healing process, we will also have complications. Those are common. Complications are possible adverse effects and reactions to the outcomes from treatment. Really common one that we talk about a lot in the healthcare setting is Clostridium difficile. So say you've been infected by an outside agent and we've started you on antimicrobial, antibacterial agents, which are killing the agent that is causing whatever disease process you're in. However, an unexpected outcome of that is that it's also killed all of your good, healthy, normal gut flora. And because you've killed all of your healthy, normal gut flora, you're now having a secondary infection with Clostridium difficile. We would consider that to be a complication or an adverse reaction of the effect of the treatment that we're giving. So all of these together, all this information together, we use to diagnose a disease, to establish what the signs and symptoms are, to come up with a syndrome. That way we can perform diagnostic tests, come up with what the actual disease is, a treatment process, and then the final prognosis. Thanks. Bye-bye.